Hello everyone, my name is Diana Machi and I'm a clinical psychologist by profession. And in today's session, we'll talk about what panic attack is, the common symptoms of panic attack, and what you can do to support your loved one who's experiencing a panic attack. So, a panic attack is one of the anxiety disorders in the DSM-5. And what happens is when one is experiencing a panic attack, it comes suddenly without warning, where they experience extreme anxiety. And this is based on perceived threat, and there's no immediate danger in the moment. So some of the causes of panic attacks include major causes, major life events that take place in a person's life that can be very stressful. Think about death of a loved one, one undergoing divorce, or a traumatic experience that one is experiencing in terms of rape cases or domestic abuse can cause one to have a panic attack. Another cause of a panic attack is one's temperament. Some people are very sensitive to negative experiences or negative emotions, and which leads them to have low resilience level in terms of handling extreme negative emotions. So it can expose them to having a panic attack. So another cause of one experiencing panic attack or being predisposed to panic attack is family history in terms of genetics. Some people who have family members or whose parents or grandparents have had a history of anxiety disorders are more likely to get panic attack themselves. Another reason why people get panic attacks is excessive use of caffeine. So we need to look out for how much caffeine, how much coffee or tea that we drink. So if it's excessive, we are more likely to experience panic attack. In terms of symptoms of panic attacks, what we need to look out for is excessive sweating. And remember, we said most of these symptoms happen to us suddenly without prior warning. So if you're starting to feel dizzy or lightheadedness in the moment, you're confused about what's going on in your environment, you feel your heart starts beating very fast, or your heart is racing, you start having palpitations, you start having numbness or tingling feeling, you start having shaky limbs. Those are the signs to look out for in terms of experiencing panic attack. So what you can do to support your loved one who's experiencing a panic attack is to know what symptoms to look out for in terms of what panic attack really is. So if one is feeling breathless, is sweating a lot, is experiencing confusion, that is definitely a person who's undergoing a panic attack episode. So what you can do to support them is first to validate how they're feeling, reassure them that everything is going to be fine, and also remaining calm yourself. So if the person experiencing the panic attack is feeling nervous and is feeling confused, and you yourself is feeling confused and feeling nervous, you're more likely to exacerbate what they're feeling. So remain calm yourself. And what you can do is to start practicing some grounding exercise together. You can hold their hand and ask them how they're feeling and staying with them in the moment. You can start saying phrases that is reassuring, that is calming for them. Another thing that you can do is to be respectful of their space. Maybe they feel like they don't need you in the room, so be aware of that you need to give them space. But also remember that you need to make them feel safe. Are they safe in the environment that they're in? I like to emphasize that there's no shame in seeking mental health support. I think there's a lot of bias or stereotype against people who receive mental health support. But at one point in our lives, we all feel unloved, we all feel unsupported, we all feel depressed or have depressive moods. And there's nothing wrong in seeking someone or looking for someone who's objective to what's going on with you, who will offer you non-judgmental reassurances on what's going on with you, and who will be able to help you walk through the journey. So do not be ashamed to seek mental health professional, or look for mental health professional when you're feeling depressed, or when you're feeling hopeless, when you're feeling helpless. Encourage your family members and your loved ones also to seek support when they're feeling low, and be your person's or your partner's or your friend's support system, and understand what I encourage you or everyone else is to be aware of the common mental disorders, and so that you can look out for the symptoms and know how you can support your loved ones or how you can support yourself. Thank you so much for today's session and for paying attention and listening to me. You can book my services on ponea.com, where we'll get to engage further at a deeper level on the different issues that you may be experiencing. Thank you.